There we are. Hi, friends. It's Kimberly here with Specialty Care Management. I just thought I'd bring you a little trick today and a call to action. I have a call to action for you today. And that is, I want you all to go and pull your last set of labs. And so here's your first tip. If you're not in the habit of requesting a copy of your lab work for yourself when you see your doctor and you have your labs drawn. That's your first homework. Start getting a copy of your lab work. You don't have to understand all of it. I promise you don't have to go to medical school, but there are 3 or 4 labs that if you start to follow and track can make a huge difference in your ability to make decisions about how you're going to live your life and where you're going to end up in terms of your health 5, 10 years from now, 2 years from now, 6 months from now, right? It's hard to change anything if you don't know where you are, right? So having a copy, a physical copy of your own lab work is really important, or being able to track it visually for yourself. A lot of folks will do that on an index card. And here are the 3 or 4 labs I want you to start tracking. When you get a copy of your lab work, I want you to take on an index card, make some columns with the different labs and rows for the time, right, for the date. But I want you to start tracking what your A1C is. If you don't have diabetes and that's not on your radar, then they won't have that on your labs. But if you do have diabetes, super important, start tracking your A1C if you're not already. Otherwise, make sure you're tracking your cholesterol, your total cholesterol, your HDL, your LDL, and your triglycerides. I want you to start tracking those. There's one more I want you to track. Actually, the one is actually 2, and that's your GFR. GFR stands for glomerular filtration rate. I want you to start tracking that and your creatinine. And here's why that's so important. Chances are when you have your lab work, it's going to be really hard for you to find your GFR on your first track. Most people, it takes them a couple of tries, a couple of sessions with a nurse or with a physician to be able to find it on your lab work. Sometimes you'll see it written as a GFR. Sometimes you'll see it written as an eGFR. Sometimes you'll see it written as glom fill rate. But you're gonna know you're in the right place because you're gonna see things like creatinine or CRE. You're gonna see a BUN. You're gonna see like sodium, potassium, those kinds of things that you probably recognize. And that's how you know you're on the right spot. Sometimes when you look for your GFR, sometimes you'll just see that, remember back in school, the greater than, remember the greater than sign, greater than 60? Sometimes it's all it's going to say. And so it can be misleading. And this is one of the reasons why it's really hard to catch kidney disease early on, is because most folks don't get to see that downward trajectory of their glomerular filtration rate. And we've talked about that before, right? Your glomerular filtration rate, or your eGFR, is just basically a measure of how fast the filters in your kidneys are working. Healthy filters, they filter really fast. The normal for a GFR is above 90. But just because it drops under 90 and it's above 60, that doesn't necessarily mean you have anything wrong with your kidneys. It doesn't mean that you don't either. The main thing for you to watch out for without having to go to medical school is to be able to watch that trajectory. If you see that you're starting off at like 106 and then you're 92 and then you're 86 and then you're 73 and then you're 61, it's still above 60, but hello, there's a big drop there. Wouldn't you agree? And so that's the perfect time for you to say, hey, doc, I've been watching this GFR and I've noticed I've dropped 30, 40, whatever, how many points I've dropped in the last couple of years or the last year or whatever. And then have that dialogue. Should I be worried about that? Why or why not? Your doctor or your nurse practitioner, your provider may say something like, Well, I'm not worried about that because you've lost weight. I'm not worried about that because you weren't on a CPAP. Now you are, and that definitely impacts your heart and your kidneys, by the way. Or you might say, I'm not worried about that because your cholesterol has been coming down nicely, or there's a reason he's not worried about that. Or he might say, you know what, it's on my radar. I'm watching that. Let's see what it does. Drink some more water, which is, if you're not drinking enough water, that may help. But chances are your follow-up question should be, okay, well, what can I do to prevent this from dropping further? And if your doctor can't answer that or your provider can't answer that, then you want to push and find somebody who can. Super duper important. All that you see when you look at your lab work and find the greater than 60 sign, all you know is that you either don't have kidney disease or you don't have stage 3 kidney disease yet. That's all that tells you. So if yours just says greater than 60, then I want you to look at the creatinine. Find your creatinine. And you're going to come into a GFR calculator. I'll show you mine. Your GFR calculator, I like the one from the National Kidney Foundation. That's my favorite source. Oh, you can't see it on there with my funky screen. You can't really see it. Anyway, it looks like an orange kidney bean. And when you pull up your GFR calculator, you'll see they have a bunch of different equations. For our purposes, we'll use the CKD EPI creatinine equation. Now, this is changing, and I'm surprised I don't see it updated on that NKF website yet. However, there is some changes, and there are speculations as to why. Basically, this formula, when you're looking for a number, when your lab only says greater than 60 and you're trying to get the number, what we do is we take the creatinine, your age, your sex, and your race, and that spits out from this formula, spits out an estimated glomerular filtration rate. It's largely because the creatinine passes through your kidneys unchanged, and that's why we use that as a way to determine your glomerular filtration rate. There are some changes coming to that formula. I understand they're removing race from that formula. So you'll have to stay tuned for that, but plug that into the formula and with your creatinine from your lab work, and it will give you an estimate of what your GFR is. Keeping in mind, for our purposes, those of us who didn't go to medical school, I did not go to medical school. I'm a nurse. I'm not a doctor. For me, the most important part to help people understand is to watch the trajectory. Your doctor's going to, when your GFR gets low or drops where you have kidney disease, your doctor's going to be watching the creatinine and probably going to do a 24-hour urine or some other studies to really look into that in depth. They're going to be watching the nitty-gritty stuff. But for you and me, let's keep an eye on if you have risk for kidney disease like diabetes or heart disease, sleep apnea, if you smoke. These are important for you to track. And not so much the number, although I'm not saying that's not insignificant. What I'm saying is, without going to medical school, the one thing that you want to watch for is, what's my number now? Where was it? Where is it going? The trajectory is what you need to know. That's going to help you ask the right questions to have an intelligent dialogue with your doctor so that you can get to the meat, which is, what can I do to prevent my GFR from dropping? What can I do to protect my kidneys so I don't develop kidney disease? Or if I have kidney disease, what can I do to delay that progression? Super duper important. And that's one of the things that your nurse coach here with our Health Rate 360 program, our CKD management program, is going to work with you in depth. It's a great benefit to our preemptive and upstream risk mitigation strategies. Anyway, take care of your kidneys, take care of yourself. Make it a great day. Bye, friends.